It's a painful, often misdiagnosed condition that affects millions of Americans. Temporomandibular joint disorder, also referred to as just TMJ, is a complex jaw and joint disorder that can involve the muscles, discs, joints, and nerves, and its effects can often be felt way beyond the mouth and jaw.
What many people don't realize is if you're having headaches, or for example, ringing in your ear, it may not be an ear problem, it may be a joint problem, a TMJ problem. You have clicking, or you hear noise in your jaw, or you feel like your jawbone is scraping. It'll cause neck pain in the back, even a shoulder.
It's a condition I suffered with for years until I got treated at Riverbend Dental Center.
I was in so much pain. My jaw was killing me, my neck, my shoulders. I was having all kinds of issues.
Basically what we saw is that your jawbone was jammed up and back, and you didn't have any space.
Before we talk about how to get relief from this painful condition, first a look at some of the new cutting-edge technology at Riverbend used to accurately diagnose TMJ disorder.
So the JVA, we use that in conjunction with something called a T-scan, which is a computerized occlusal analysis. And it tells us how hard you're hitting, and this is telling us how much noise you literally have in your joint. This is almost like an EKG, but it's an EKG of the joint.
The test takes just a few minutes, but gives the doctor a lot of information.
Well, right now we're putting the JVA on you right over your joints. We're going to have you look at the screen, and we're going to ask you to open and close. Close, close, wide, close, wide, hit accept. Your right joint had a little more of an issue than your left joint. That's what this is showing. So you can measure the improvement. And that's what makes the JVA and what we do so much nicer, because I could see it in black and white.
Other diagnostic tools used to give Dr. Schmidt an overall picture of the patient's condition, cutting-edge 2 and 3D x-rays.
This is looking at it on a 2D x-ray, the Panorex.
Once a diagnosis is made, there are a number of non-surgical treatment options available, including this Mora device that's given me a lot of relief.
This has been life-changing, what you all have been able to do for me.
A lot of times TMJ is treated with a splint, but what you really need to do is to treat to the jaw position. This is a device that you actually put it in and it repositions your jaw in a down and forward position and basically takes the pressure off of your skull.
Other appliances can also be used depending on the patient's condition, and lifestyle changes are also important. For me, it's meant no more chewing ice, gum, or almonds. Bottom line, TMJ disorder can be painful and life-altering, but it is treatable.
Don't wait till you get to where I was when you're in that much pain to come in and see you, because I guess the earlier you get in, the better.
Absolutely. Don't neglect those symptoms, and don't feel like everyone's living in pain like you are, because it's not normal to have pain.
Riverbend Dental Center on Maple Street, comprehensive cutting-edge general and cosmetic dentistry where patients feel like family.